Some news today from Ontario, where Doug Ford, the once populist candidate who ran on dollar beers, has since cucked harder than Boris Johnson. And this is a story about why we should always trust the scientists and medical experts. Doctors, Teachers Union sounds support for physician questioned over possible conflict. And that's this little guy down here, not this bearded guy up here. So the Elementary Teachers Federation of Ontario and a chorus of doctors are sounding an alarm over a statement issued by Premier Doug Ford's office casting doubt on the integrity of an epidemiologist who has been critical of the Ford government's handling of the coronavirus pandemic. It is beyond concerning that this government is yet again attacking an expert for bringing critical attention to issues that are so important to everyone in this province, ETFO President Sam Hammond told CP24 in an interview Wednesday. There's a lot of unfortunate acronyms in there. Hammond's comment followed a statement issued by Premier Doug Ford's office Tuesday evening, which sounded concern over a possible conflict of interest on part of Dr. David Fissman, an epidemiologist at University of Toronto's Dalla Lana School of Public Health. The concern in the Premier's office was triggered by an article in the Toronto Sun the same night, suggesting that paid work Fissman had done for the Teachers Federation might constitute a conflict with his role as a member of the Ontario Science Table, particularly when it comes to the table's advisement on the government of school closures. So skipping a paragraph, it says the office expects any members to disclose any actual or potential conflicts of interest and that they didn't know about this. And Dr. Fissman just basically said that, well, they should know because it was public and, I don't know, they should know. So Fissman says that his service to ETFO included reviewing evidence on kids and COVID-19 and the importance of ventilation and aerosol transmission, is what he said on Twitter. And so the government is accusing him of bias for taking money from the Teachers Federation, right? So, colleagues sound support. A chorus of doctors took to social media to express support for Fissman Tuesday night, and by early Wednesday morning, the hashtag of "Thank you, David Fissman" was trending on Twitter. Thank you, Dr. Fissman, for educating us on infectious disease epidemiology with facts and memes. Despite facing constant threats and harassment, family physician Dr. Jennifer Kwan wrote, Hashtag no thanks to those who attack and silence physicians and scientists for speaking the truth and trying to save lives in a pandemic. Some other people said some other shit. Deputy Prime Minister Christina Freeland and Toronto Board of Health Chair Joe Cressy also spoke in support of the guy. And I'm sure like a whole list of other people, right? So let's go check out that hashtag. Wow, my own hashtag. Thank you all so much for your support and the many kind messages and emails. It's neat to wake up to a 1,000 to 2,000 more Twitter followers, blah, blah, blah. But again, this is not about me. I'm a one voice of many, so this is his victory lap, right? But I understand, Ontario's pandemic response has been a mess. As other provinces have struggled, they've learned and adapted. Doug Ford has had abundant access to good guidance. He's ignored much of it. We saw this manifest in the crossing of streams as Ontario overtook Quebec, and we now have the largest COVID-19 epidemic in Canada. Look at that chart. Hopefully you're spotting this. What's OE plus 05, whatever. I mean, that doesn't make sense to most people, but cumulative cases. So you're making the case that they're handling it wrong based on their cumulative cases for two provinces that each contain nearly a third of the population of the country. Right? So orange right here, you're looking at Ontario. Purple is Quebec. Those provinces have nearly 10 million people in a country of 36 million. So they're 20 million out of 36, 38 maybe million. And those are just loose estimates. And as a post somewhere below rightfully points out, as a scientist, surely you understand that not normalizing by population takes away from your point. It would be like comparing Canada to the USA and saying, we have 1/20th of the cases, we're doing 5,000% better, so why not relax? And the absolute apologist says, People have been looking at these graphs of pure case numbers for a year now, and I'm pretty sure everyone gets Ontario has a larger population. What's worrisome is the number of cases Ontario added over such a short time to overtake Quebec, who have also done well at botching the job. Apparently it wasn't actually clear enough because this brainiac didn't seem to notice that Ontario has 75% more people than Quebec. You'd think they ought to have 75% more cases, but even failing that, 75% more growth. And to be on par at all or to catch up to them in total cumulative cases simply isn't the catastrophic event that they're making it out to be. Well, isn't that convenient? I'm sure everybody in the world knows the population of Quebec, Ontario, and all the other provinces in Canada. Somebody stumbling over this from Scotland, they're gonna know exactly what you're talking about. By the way, I caught Count Dacula's joke today about Belgium not being a real country. I'd like to remind them that they have twice the population of Scotland. And so we're gonna go back up to this chart and look at it, and we're all supposed to intuitively know that territories, we got territories somewhere down here, and we're supposed to just automatically in our minds scale that up per capita and know if it compares to these provinces, right, on a per capita basis, and repatriated. Whatever that group is, we're supposed to know if on a per capita basis, right, a normalized population basis, if they're on par with these other groups. Yeah, it's a bunch of bullshit. And this is why you shouldn't trust science and the experts and the government, especially when they're all working together. This is a guy with a hashtag who's got deputy prime ministers and, all sorts of top health officials rushing to his defense, giving you this bullshit chart. And then everybody's standing on their fucking heads to support it. The situation in the GTA and Windsor have been particularly difficult to control. We know that the disease has disproportionately hit disadvantaged people of color in the province. We know it has amplified in industrial facilities that have apparently been untouchable. Doug Ford was a fool for ever going along with the narrative, and it's been pretty clear for, the entire time, but it's pretty clear also from the statement of Dr. David Fissman. Measures President Biden is introducing fast are those that many of us in Ontario have called for since last summer. Don't let them distract you. Hold Ford to account for his many failures, for protecting his long-term care home owning friends rather than you.